Charlotte is known for both growth and opportunity, but not everyone has the same access to both of those. For Charlotte's Black community, specifically, health disparities remain a daily reality, showing up in higher rates of chronic illness, limited access to care, and even outcomes tied closely to zip codes.
WCNC Charlotte's Autumn Bracey spoke with local leaders who say they're seeking solutions to close those gaps.
County Health Rankings and Roadmaps, a program of the University of Wisconsin Population Health Institute, places Mecklenburg County among the healthiest communities in North Carolina and across the nation. But beneath those positive rankings, health leaders say deep disparities remain, especially when health outcomes are broken down by race. From maternal and child health to chronic disease, Black Charlotteans continue to face disproportionate health challenges.
Bias, discrimination, overt racism is not, the hospital's system is not excluded from that.
Dr. Janisha Brown says her work is deeply personal. After having a heart attack following the birth of her second son and being misdiagnosed in the emergency room, she knew something had to change.
For my case, I presented for chest pain. And I had very classic symptoms of a heart attack.
That experience led her to create WeBe, the Women's Empowerment and Birth Equity Institute. The organization focuses on identifying health disparities impacting Black women and finding real solutions. Dr. Brown says education is a big part of the work, but she says holding healthcare providers accountable is critical for progress.
Having an alert in the system saying, hey, this patient has all these, symptoms, and they're also, reporting this out of their mouth. Have you checked on, the most concerning things?
The Mecklenburg County Public Health Department is also taking aim at health disparities. Interim Health Director Kimberly Scott says where you live matters. Explaining socioeconomic factors, including your zip code, can directly affect your health and quality of life.
When we think about maternal and child health, 28208 is one zip code where we've seen disparities in infant mortality.
CDC data shows Black women are 3 times more likely to die from pregnancy-related causes than white women.
African Americans have a higher pain tolerance, or that we are dramatic, maybe kind of fabricating what we are experiencing. I think I hear too often how, one of my patients went to another doctor and it took 4 visits before they were actually offered an ultrasound.
Co-founders of FemWell Gynecology and Wellness, Tiffany Bates and Nikki Parsons, say they're using their practice to create change firsthand.
The patients are seeing actual changes in their weight, their bleeding, their overall mental health.
Back at the county level, Scott says her agency is continuing to take action to address these alarming rates as well. One approach includes using its fleet of mobile health units to bring testing and resources directly to communities facing barriers, while also partnering with local organizations.
We've invested in supporting community health workers and health educators, so trusted messengers who are reflective of the community served, to make sure that we have culturally appropriate messaging and information to support people's needs in navigating what can be a challenging system.
Mecklenburg County conducts a community health assessment every 3 years to better understand residents' health needs and identify gaps in policies and programs. The latest report is set to be released at the end of March. In Charlotte, Autumn Bracey, WCNC Charlotte.